Okay, I'm here at the 25th annual Diabetes Walk, and with me today is two people that are here at the walk, and why are you here at the walk?
Because I have diabetes, but we're walking for our church.
Okay, and how long have you had diabetes?
About 20 years.
Okay, so you're living with it and functioning.
Yes.
Okay, do you find that difficult?
No.
When you're here just to support?
Just to support, yes.
Okay.
Yeah.
I'm here with Kevin Kelly, and he's the executive director of the walk.
Of the American Diabetes Association.
Well, you put on a great walk.
Thank you. It's a great opportunity for folks to come out. Beautiful day today. We have over
great day.
1,500 people. We have our first 5K run this year, all to raise funds for supporting folks who live with this disease every day so that we can hopefully one day find a cure, find a way to support those people who live with the disease, and find a way to support those who support those with the disease. Because it's not just those living with the disease, but the caregivers as well.
I guess you take the scary out of diabetes with the information that you give out.
We try to make diabetes as scare-less as possible, but the reality is it's a very difficult disease for people to manage. And folks have to really pay attention to their weight. They have to pay attention to their lifestyle as well as their medication. They have to be keeping regular contact with their physicians. And that's not an inexpensive proposition for anybody in any community because it's a regular daily fight.
I've heard that it's one of the most preventable diseases. Do you guys do a lot on prevention?
We do as much as we can on prevention. We're trying to get the word out through events like this, through our walk, through our tour that happens in June, our Tour de Cure, which is a bike ride through the hills of Ambler. We try to tell people that living a healthy lifestyle can make a significant difference simply by losing 7% of their body weight, which really for somebody who's 200 pounds is about 15 pounds. So if you lose a little bit of weight and you keep yourself in shape and you eat healthy, then you certainly can help prevent the onset of type 2 diabetes.
Hey, now this is a fundraiser. Can we still give some money even though the event's over?
Absolutely. We fundraise for every event multiple times through the year, but for this walk, you can simply go to diabetes.org/stepoutphilly and donate to the cause. And you can continue doing that for the next 30 days. That's when our website will shut down for this year's fundraising, and then it will open back up for next year's fundraising in the beginning of January. But absolutely, go to stepoutdiabetes.org/stepoutphilly.
I want to thank you for putting on such a great event and making people aware of diabetes and, like I always like to say, taking the scary out of it.
Thank you. It's a great opportunity for the city to come together to support this community of folks living with this disease.
Thank you.
Thank you.
All right, I'm here with Jeremy Dieter, and he's from?
NovoNordisk.
I couldn't say that. So, how did you guys get involved with this? I noticed you're one of the sponsors.
Yeah, NovoNordisk has been in the diabetes business for about 90 years. We are an insulin producer, and we are a national sponsor for the ADA, and we have come out here to help the Philadelphia chapter of the ADA raise awareness and raise money.
Fantastic, and we need more corporate sponsors like that because it's a bad disease. I think it's like 28 million people that have diabetes.
Yeah, that's about right, and it's not getting any lower. So we're here to help out patients and to bring awareness and help out the ADA with their mission.
And that's just the people who know they have diabetes.
Yes.
There's a lot more out there.
Yes.
And then we have pre-diabetics.
Yes.
So there's a lot of people out there that need people like you to step up to the plate and walk.
Well, I'm lucky to work for a great company that really takes its patients seriously and really takes its mission seriously of helping patients and bringing awareness and helping patients live a better life with diabetes.
And I'm here with Lola Sargent, and as you see, she's wearing a medal. How did you get that medal?
Well, I got the medal by being a champion fundraiser for the American Diabetes Association. And so when you raise more than $1,000, you're presented with a medal.
Whoa, that's really good. And if we have more people like that, we'd have a lot more money for diabetes.
Absolutely.
So, do you have diabetes?
I do. Yes.
How long have you had that?
I've had it for more than 20 years. And I used to keep that private. I didn't share that with a lot of people. But I realized that I've been able to really control my diabetes I apply a pretty rigorous regimen, and I do it because it's so important, because I have a lot of things that I want to do in this life. And diabetes is absolutely a condition that can be managed. It does take a little bit of discipline, but it can be managed. And I just want to be out there, and I want to try to empower other people to manage their diabetes.
Now, does anybody else in your family have diabetes?
You know, I have maybe some distant relatives, so it wasn't anything that has run. I'm actually a type 1 diabetic.
Okay.
So, yeah, it's a little bit different, but it does require a more rigorous regimen. So, but I just incorporate it into my everyday schedule. So it's kind of like wearing contacts, I do what I have to do, and I keep it moving.
That's good. And I'm hoping that there's something. I know there's no cure for type 1. We're looking at cures for type 2. What type of hope do you have when we talk about the diabetes?
I'm tremendously hopeful. There are a lot of technologies. I wear a pump, and so that helps me tremendously because it really makes it more convenient to be able to go about my daily schedule. I do a lot of traveling. I've traveled all over the world. I am an athlete. I ran in our inaugural 5K run this morning. I've run the marathon. I've run in the Broad Street run. So there are a lot of tools, and there's a lot of technology out there that can allow all diabetes to be able to manage their conditions. And so that's one of my goals, is to get the word out there about really kind of owning your diabetes from a standpoint of managing your diabetes for optimal health and optimal outcomes.
Well, it looks like you're doing a great job. I want to thank you for stopping over and educating everybody about diabetes, especially type 1.
Thank you so much.
Thank you.
Take care.
And I'm here with
Sunday Jones,
Denise Vaughan Lee, Denise Lee.
And I see you're wearing some colorful shirts. Is this someone that you're representing today? Okay, is she with us? Okay, this year. Okay, so how long have you guys been supporting this event?
Second year for me, they're first.
yes,
Okay, and it looks like a fun event. You're going to be back here next year?
yes,
I know,
absolutely.
I think
Most definitely. And I'm here again with two people doing the walk, and your name is?
Pat. Debbie,
And Debbie, why are you guys walking today?
because I have diabetes and I wanted to help raise some money for a good cause.
And you're here too.
Well, mainly because Pat asked me to go with her, but also it's a fear that, it affects so many people. It's a great cause and it was a beautiful day and I wanted to support Pat.
And I'm here with four special ladies. Now they're out here on a Saturday morning volunteering, but they belong to a special group. Tell me about that group and why you're out here.
So we're from Gamma Sigma Sigma. It's a national service sorority from Drexel University. So we love to do service.
What's that?
We love to do service.
We do not just like different walks, but we do a lot of different things. So we go to like soup kitchens. What else do we do? Broad Street Ministry, Lemon Run, Lemon Ball, stuff like that.
Yeah, and we're having a great time out here supporting a great cause, so it's awesome.
And they gave me one of these hats. So, more people like them would make the world a lot better place. And they're supporting a great cause today, diabetes, and they're handing out these great hats for people who are, let's say, suffering with diabetes and going through it. And I had my scare. I was pre-diabetic. Hopefully when I go back to the doctor, my AC1 is down and my blood sugar's down too. So hopefully with people like them helping me out, I'm sure it's going to be down. Thanks, ladies.
Thank you.
I'm here with Rigo and Tom, and they're at one of the very important tents here at the Diabetes Walk. Tell me about this tent and why it's here.
Absolutely. So, we just have a bunch of information here. We're trying to get some more awareness for diabetes. We're also taking names and emails down of people. We're looking for more advocates because we're trying to expand the government programs that we have in the country. So the more advocates we have, the better.
And Rigo, why are you here?
Honestly, my good friend told me about this. I wanted to come here, support him for the people who have diabetes, and just make sure everyone gets aware about this whole situation.
Yeah, 28 million people have diabetes, and that's a lot of people. And we need to do something about it. And I think awareness is one of the big things. Making sure prevention sets in, making sure people know about it. It's one of the most preventable diseases, and we can do something about it. Absolutely. And these two guys here are the advocates. And they're looking for more advocates, so if you're not here today, go to the Diabetes Foundation and sign up.
We got free bags.
I'm here with 4 great volunteers, and their names are...
Rachel.
Amber.
And Joel.
I'm glad everybody's name wasn't Rachel. But you guys are doing a very important job here. Tell me about this tent.
Oh yes, this tent, it belongs to the 88. It's their store, so they sell their paraphernalia in order for their organization to help function.
And what got you up this morning to do this?
Well, it is a great cause, as well as we do have a friend that interns for ADA, so we're just helping out with him and everything like that.
A great bunch of volunteers. And one more on the end here.
What am I saying?
He's shy with the camera, but he's out here also, and he's helping out for this great cause. They have a great store. Hopefully, they can still sell these things online. So go to the Diabetes Association's website and still purchase things if you didn't get out here today to purchase any of these great T-shirts or things they have behind me here. Okay, I'm here with MidAtlantic Retina, and somebody's going to tell me about this. What do you guys do?
I'll tell you about it. So, we are the retina service of Wills Eye Hospital, and this is our 6th year sponsoring the ADA. There's lots of people with diabetes who are affected by a diabetic retinopathy, which is a very serious eye condition. So we're here trying to promote the Learn tent to learn about diabetic retinopathy, getting a dilated eye exam every year to 2 years, and keeping your levels in check.
Good. I mean, have you guys been here? Were you here last year?
Yep, we've been here for, like I said, this is our 6th year in a row that we've been here as a sponsor. So yeah, happy to do it, happy to support.
What about you? Why are you here?
Oh, well, I work for this wonderful company, and we believe in what we do. We care about people's nutrition, not stop smoking. Our doctors are such great advocates about counseling our patients, and that's why we're here. We want to educate people to be healthier.
That sounds like a good idea.
I'm here, part of it's because I work with the company, and part of it's because my husband's a diabetic, so if this helps all the folks with diabetes find a cure, then it's great.
I think you guys are doing a great job. We got one more volunteer over here. Want to get her in?
I'm Suzanne. I've been with the company for 5 years now, and I assist January in all the marketing efforts, and my mom was diabetic, so I do this for her.
There you go. We got people that are actually being affected by diabetes, and it's a great company. And I want you to take information. If you're not here today, how can they get in touch with you?
Our website is www.midAtlanticretina.com, and you can reach us toll free at 1-844-MAR-DOCS.
That sounds like a plan. I want to thank you ladies for coming out here and supporting such a great cause.
Absolutely.
Keep up the good work.
Thank you. It's a great day for a great cause.